Another Johns Hopkins study on this subject was published in February 2007 issue of Diabetes Care. This was the result of a National Health and Nutrition Survey. Quote, low free testosterone concentrations in the normal range were associated with diabetes, independent of obesity. These data suggest that low androgen levels may be a risk factor for diabetes in men. Let me repeat that first part. Low free testosterone concentrations in the normal range were associated with diabetes. Close quote. This is the study that clearly supports my contention in video 6 that current laboratory reference ranges cannot be relied upon to diagnose testosterone deficiency. If low normal testosterone levels are associated with diabetes, then obviously these low normal values are insufficient for good health. An enormous number of people whose testosterone values fall within current laboratory reference ranges do not have an adequate amount of the hormone to be healthy. Here's another opinion on replacing testosterone. This one from the United Kingdom. It was published in the February 2007 issue of the International Journal of Clinical Practice. Quote, quote, men with the metabolic syndrome and symptoms of testosterone deficiency may be managed by, in the absence of contraindications, testosterone replacement therapy, along with weight reduction and other measures to normalize glucose, lipid, and blood pressure control. Close quote. They also stated that testosterone deficiency was, quote, a potentially common and underdiagnosed condition in men. Close quote. Testosterone deficiency may be associated with more than just getting type 2 diabetes. This study on females came out of the University of Arizona and was published in the March 2007 issue of the American Journal of Physiology. Quote, changes in the estrogen-testosterone balance at menopause may negatively influence the development of diabetic kidney disease. Furthermore, recent studies suggest that changes in hormone levels during perimenopause may influence disease development. The University of Arizona is saying that testosterone replacement may prevent or delay the #1 cause of kidney disease in the United States, and no one is paying attention. Here's more on the association of testosterone deficiency with the metabolic syndrome and the effects of testosterone replacement. A November 2007 study from Beth Israel Hospital in Boston. Quote, low serum testosterone level has emerged as a reliable prognosticator of the metabolic syndrome in men. 1/3 of men with type 2 diabetes mellitus are now recognized as testosterone deficient. Emerging evidence suggests that testosterone therapy may be able to reverse some aspects of the metabolic syndrome. Close quote. If they had used adequate ranges of testosterone to make a diagnosis of testosterone deficiency instead of normal ranges, I believe they would have found that almost all men with type 2 diabetes have testosterone deficiency. And finally, yet another study out of Johns Hopkins, this one in June 2007 on treatment. Quote, the relationship between diabetes, the metabolic syndrome, and testosterone deficiency is complex. Testosterone supplementation by either oral or intramuscular routes and through exogenous or endogenous delivery has a promising role in this population, although further clinical trials are needed. Close quote. What we have is a flood of studies from major research institutions, all confirming a causative or aggravating connection between testosterone deficiency and type 2 diabetes. I don't know to what degree testosterone replacement will benefit the millions of us who have type 2 diabetes. I have no way of knowing the effects of testosterone replacement on the many long-term complications of diabetes, such as blocked arteries in the heart, in the brain, in the legs, or the vision loss and blindness brought on by diabetic eye disease, or the slow destruction of the kidneys by those with that complication. But I do know two things. Given the current medical neglect of testosterone deficiency and testosterone replacement, very few, if any of us, with type 2 diabetes will be alive when that information finally becomes available. And there is absolutely no reason to not treat all of us with type 2 diabetes with testosterone replacement right now. After being available by prescription for over a half-century, there is no known downside. Remember, testosterone is approved by the Federal Drug Administration to treat any symptom of deficiency. So go to your doctor and demand to be tested for and treated for testosterone deficiency. It's your health on the line. Don't take no for an answer. Earlier videos in this series, as well as the abstracts of all these studies and over 6 dozen more, are viewable on my website, www.thehiddendisease.com. My next video will deal with vascular diseases in men, and the following with vascular diseases in women. Please help me make sure that everyone with type 2 diabetes has the opportunity to learn about the existence of this disease and its relation to diabetes. Talk about it, tell people about it, email the video links, become an advocate for better health. I'm Dr. E. Barry Gordon. Thank you for watching.